just the uncertainty of what's going on, people, being isolated. We already sadly have a very high rate of youth suicide in our state. We lose 2 to 4 young adults every week in our state to suicide. And we're just really concerned. We're concerned. A recent survey showed 4 out of 6 youth are feeling anxious and depressed. And you think about being separated from your peers and just again, the uncertainty of the time. So yeah, I think behavioral health and thinking about our own health is more important than ever. And I saw a cup the other day and it said, it's okay to not be okay. And I think that maybe the silver lining is when you ask someone how they are, they say, I'm struggling. It's stressful, and we can talk about that, and that opens the door to getting help. And I think part of the work I've been doing is how do we make sure when someone has that courage to reach out, they really get the help they need. And it's been really interesting. I've been chairing a series of meetings with law enforcement and behavioral health specialists and community members, because, police officers aren't social workers, right? And they didn't receive that training, and they did it as a result of not having a well-funded and responsive behavioral health system. And so what we're looking at is really how do we really make it so if someone's in crisis, someone can be there right away and be in the community. And how can a team of people not only help during that crisis, but connect them to services or what they need, right? Maybe they need help with their social security. Maybe they need help getting a job. Like, how do we really have a system that responds real time? And the good news is at the federal level, there's what's called 988, and that was just signed last week. And that's going to create a line. So it's kind of equivalent to 911, but it would be the number you would call when someone's having a behavioral health crisis. And that will allow us to create some funding to maybe have a better way to triage and support crisis services that we've never had. So I'm really excited. I think this is a time to rethink how services are provided in our state, to make sure they're more standard across different counties, to make sure that we're reaching people in crisis early and engaging and really making those connections, right? So they don't feel like they have to travel this journey alone. So I think it's an opportunity, and I know it's a stressful time and we got a tough road ahead, but if we really can all work together and get these services up and running, I think we'll all feel that support, right? And we can all take care of our mental health and our family and our neighbors, and really have a community response.